Welcome to my YouTube channel, Everything Medical. Today's video, we shall be looking at the anatomy of the carrying angle. Yeah, the carrying angle is an important angle of deviation on the upper extremity, that is the upper limb. If you are coming across my channel the first time, don't hesitate to subscribe so that you get notification when I upload video on human anatomy. Without wasting much of our time, let's proceed. The first thing we shall be looking on to is the introduction. The introduction. What is carrying angle? Carrying angle is an angle of deviation of long axis of forearm from the long axis of the arm. It's an angle of deviation from long axis of the forearm from the long axis of the arm. You get? It's an angle of deviation of long axis of the forearm from the long axis of the what? Of the arm. Now watch. So the carrying angle is an angle of deviation of long axis of forearm from the long axis of the arm. That is the concept of the carrying angle. So that is the what? The concept of the carrying angle. You get. Now, important to note, the transverse axis of the elbow joint is not transverse, rather it is oblique. You get. As you can see, the transverse axis of the what? Elbow joint is not transverse, rather it is what? Oblique, which is directed what? Downward and medially, because the medial flange of the trochlea of the humerus lies 6 millimeter. It lies what? 6 millimeter below its lateral flange. Consequently, when the elbow joint is what? Extended. When the elbow joint is extended, the arm and the forearm do not lie in the equal straight line. They do not lie in the straight line. Rather, the forearm is what? Slightly deviated laterally. It is slightly what? Deviated laterally. You get, thereby creating the carrying angle. You get, because if you watch, when the elbow joint is extended and what? And supinated on this way, you could deduce that there is a carrying angle being created, and the forearm do not lie in a straight line with the arm. So the forearm is slightly deviated laterally, thereby creating the carrying angle. You have to understand that the carrying angle in female is usually pronounced. Carrying angle is pronounced in female compared to what? To male. And carrying angle disappears during what? Pronation and what? Flexion of the what? Of the forearm. Carrying angle is usually disappeared during pronation and complete flexion of the what? Of the forearm. Whereas carrying angle is pronounced during extension of the elbow and supination of the elbow. That is the two difference between the pronounced carrying angle and when the carrying angle is what? Is disappeared. Now, let's take a good look at the next outline, which is the range. The range. We have male and female. Now watch. The range of carrying angle varies. Carrying angle varies. It ranges from 5 degrees to 15 degrees. That is the range of the carrying angle. The range of the carrying angle, it ranges from 5 to 15 degrees. And the carrying angle varies among the both sex, that is the male and female. The range of the carrying angle in male is 5 degrees to 10 degrees, whereas the range of carrying angle in female is between 10 degrees to 15 degrees. You could deduce that the difference in carrying angle among the both sex, you get, particularly the female, indicate the secondary sexual characteristics, which is relatable to an increased elbow joint laxity. You could deduce that females carrying angle, their elbow joint is usually on this manner. The forearm is highly slightly deviated laterally, thereby creating a pronounced carrying angle. You get. Why is it called a carrying angle? Because it helps female, even male, to carry especially gallons of water, or particularly a gallon of water and a bucket, so that the arm can swing clearly without hitting the hip. That is one of the cardinal importance of the carrying angle. You get. Now, these are the range of the carrying angle. The heat range varies. They have 5 to 15 degrees. Now, the range in male is between 5 to 10 degrees. Between what? 5 to 10 degrees. And female is between what? 10 to 15 degrees. Now, let's take a good look at another importance. The importance of the carrying angle. The importance of carrying angle. The carrying angle has an importance. The carrying angle, or the purpose of the carrying angle, is that it allows the arm to swing freely while walking without hitting the hip. That is the number one importance of the carrying angle, or its prime or peculiar importance. It allows the arm to swing freely while walking without hitting the hip. So this is the importance of the carrying angle, or the purpose of the what? Of the carrying angle. You get. So that is how it is being done. Now watch. I said previously that the carrying angle is usually pronounced during what? Extension of the elbow and supination of the what? Of the elbow. Of the forearm, they say. Extension of the forearm and supination of the what? Forearm. Get. Because it will be what? Slightly deviated laterally. But the carrying angle disappears during what? Pronation and full flexion of the what? Of the forearm. Now watch. This is the carrying angle. Carrying angle of 10 degrees to 15 degrees. That is the what? The carrying angle. Now, here is the lateral deviation or outward deviation of the what? Of the forearm, thereby creating a pronounced what? Carrying angle. You get? Because when there is a lateral or outward deviation of the forearm, particularly when it is extended and spinated, there is always a pronounced carrying angle. So we have lateral stroke outward deviation of extended and supinated forearm. So that is how it is being done. The next outline we shall be looking on to is the clinical correlation. The clinical correlation. Clinical correlation. Number one, we have cubitus valgus. This cubitus valgus can be called increased carrying angle. It can be called increased carrying angle. The cubitus valgus can be called increased carrying angle or an excessive carrying angle. It causes instability of the elbow joint. It could cause pain around the elbow joint. It could cause other clinical deformities around the what? The elbow joint, such as reduced elbow flexion. It could pose a risk factor to elbow joint dislocation and fracture of the bone that surrounds the what? The elbow joint. So that is all about the what? The cubitus valgus. The next is the cubitus varus. Cubitus varus can be called decreased carrying angle. Decreased what? Carrying angle. It is a condition whereby the carrying angle is decreased. It could cause ulnar nerve entrapment at the level of the what? Of the cubital tunnel. You get, thereby causing the what? The numbness of skin around the pinky fingers. You get, and when there is a decreased carrying angle, it could pose other problems that could arise at the level of the what? Of the elbow joint. So the cubitus varus can be called decreased carrying angle. The next is tennis elbow. Tennis elbow can be called lateral epicondylitis, lateral epicondylitis. It is a clinical condition whereby there is pain or tenderness at the region of the lateral epicondyle of the humerus, which could be caused by sprain to the radial collateral ligament of the elbow joint. It could be caused by a tear or it is caused by a tear to the fibers of the extensor carpi radialis brevis. It could be caused by an inflammation of the bursa underneath the extensor carpi radialis brevis. It could be caused by inflammation of the common extensor origin. You get, those are the factors that could trigger what? Tennis elbow, which is a pain or tenderness at the region or at the level of the lateral epicondyle of the humerus. Number 4 is golfer's elbow. which can be called medial epicondylitis. Gopher's elbow can be called medial epicondylitis. It is a clinical condition whereby there is pain or tenderness at the level of the medial epicondyle of the humerus. You get. It could be caused by inflammation of the what? Common flexor origin, thereby presenting pain and tenderness at the region of the medial epicondyle of the humerus, which can be called medial epicondylitis. So I believe we have done justice to the carrying angle, ranging from its clinical relevance, ranging from the introduction to the clinical relevance. Thank you so much for staying to the end of this class.